Today we have Farah from Mount Sinai, and she will be talking a little about Hep C.
I am part of the REACH program. REACH stands for Respectful, Equitable Access to Comprehensive Healthcare, and we're part of Mount Sinai Hospital. Our clinic is located at 17 East 102nd Street in East Harlem. I'm here to talk a little bit about Hep C. Our program takes a harm reduction approach, and we really focus on providing primary care for people who use drugs or are at risk of relapsing. We also provide hepatitis C treatment and additional treatment for people with opioid use disorder, like buprenorphine treatment. So what's harm reduction? So harm reduction is really a spectrum. We know that people with substance use are in the a spectrum and the continuum. Basically, somebody can be completely abstinent, not use. Somebody can, use any type of substance, including alcohol, socially. And we also have people that are at the other side of the spectrum that, can be using alcohol and other substances in a very dangerous way. And the idea is to really work with patients and really kind of like assess what are their goals and working with them. So what I'm trying to say is that we're not an abstinence program. We really try to work with patients and meet them where they're at and try to work on their health goals. Just kind of giving you an overview of what harm reduction really means. The World Health Organization, but they set up these goals that they wanted to reduce hepatitis C by 2030. And our program and others in the city have been doing like a really intense job to really try to eliminate hepatitis. And the goal is to really, by 2030, reduce 90% of infections and reduce mortality by 65%. But the liver it's a filter, basically. And that's why it's so important that, it also stores nutrients and filter toxins and produce proteins. So that's why it's really important that we take care of it. And what happens is that the hepatitis C virus affects the liver, and hepatitis stands by, or the word hepatitis means inflammation of the liver, as you can see in this slide. And that's why it's like really important that if somebody has hepatitis C, that they get the treatment that they need right away. So there's different types of hepatitis. The three main commons are hepatitis A, B, and C. So hepatitis A is transmitted by, it's not as common in the US, but it's transmitted by food or water that is contaminated. But there is a vaccine for that. So if you don't know that you have had the vaccine, you should just check with your provider, and they will be able to just check if you need the vaccine, they will give you the vaccine. Hepatitis B is transmitted by blood, sex, sharing needles, or mother to child, but there is also a vaccine for hepatitis B. Hepatitis C is transmitted by blood to blood, and there is no vaccine for it. So that's why it's really important that, and we're gonna talk about a little of some of the ways that you can get hepatitis C, but that's why, because there is no vaccination, we have treatment, and we're gonna talk about the treatment as well. Hepatitis C is transmitted by blood to blood. So how you can get it? So it could be by personal grooming items. For example, if you share nail clippers, razors, toothbrushes, because there is kind of like bleeding in all of those. So your personal grooming items should not be shared with anybody. Before 1992, if you had a blood transfusion or an organ transplant, it's really important that you get tested. Tattoos and piercings are not done in a licensed shop because, the safety measures may not be followed. If you inject drugs or snort drugs, because there is like risk of blood-to-blood transmission as well. If you had dialysis, it's really important that you get tested, and mother to child, but that's really uncommon. So ways that you cannot get hepatitis C is, for example, if you sneeze, cough, if you hug somebody, if you share utensils or share, like a cup of water, you will not get it. Again, it's blood to blood transmitted. the most important thing about this slide is that you should not share any of your personal grooming items with anybody. And if you have a cut, that you protect yourself, not only for yourself, but to protect others. So if you have an open wound, please, use a Band-Aid. So this is a really important fact about hepatitis C, and is that under the right circumstances, under these surfaces, hepatitis C can live in different environments. Like we can see over here that it can live in a syringe for 63 days, in a surface, like a table surface, for 16 days. So again, it's really important if you have an open wound that you cover yourself. These are kind of like some measures for people that inject drugs, like some people use bleach, which is really good, but you can also use water or other measures. And this is just information about that. So what are some of the symptoms of hepatitis C? Hepatitis C, it's really called like a silent disease because there is really no symptoms. So some people feel fatigue, joint pain, depression, belly pain, vomit, nausea, or they don't feel anything. So that's why, again, it's really important that you get tested, because you may not know that you had it. This is something really important to mention, is that if somebody has hepatitis C, the reason that we want to treat it is because it will affect your liver. But for these to happen, it will be with many, many, many years. We can see in this slide that it takes up to 30 years for somebody to develop cirrhosis. And the reason that we don't want somebody to go into cirrhosis is because, as we were mentioning before, the substances that our body produces, the proteins, that will not be able to get filtered, and the blood will not be able to get filtered in the liver. And in a small percentage of cases, you can also develop liver cancer. So those are all the things that we're trying to prevent when we're trying to not only get the testing to know your status about hepatitis C, but also the treatment. And there is like this is three, but two main tests for hepatitis C. The first test, it's called an antibody test, and we're actually able to provide that testing as a rapid test. It's a finger stick, and it takes less than 20 minutes or around 20 minutes to get the results back. And it will tell us if you have ever been exposed to hepatitis C, and that's called an antibody test. But it's really important to also do a confirmatory test. If that test comes positive, then we do a second test that right now we're able to do also as a finger stick. And that test will be able to tell us the replications of the virus, if there is any replications of the virus in the blood. And that takes a week and a half for us to get results back. But again, right now, we're able to do both tests as a finger stick. It's really easy and fast. And the last test that is over there is a genotype, and really will tell us what type of hepatitis C you have, but this is not as used often. This is kind of like an old presentation. But those two tests, the antibody and the viral load, are the most important to know your status. Again, we will do the viral load if the antibody test is positive. Otherwise, they will not do the viral load because it's a confirmatory test. And this is really what those results mean. So some of the recommendations, if your antibody is negative, is that you get a screen once a year if you don't have any risk factors, or every 6 months if, for example, you have multiple sexual partners, or if you inject drugs or use drugs just because of the risky behavior. It's really important that if you inject drugs, you don't share any of the equipment, because the blood could be in any of it, and that you practice safer sex. So if you have hepatitis C, we will help you. We're connected to our clinic, and our providers have a lot of experience treating patients with hepatitis C, so we will schedule an appointment. It's important that you reduce the amount of alcohol that you intake, because that will further damage your liver. It's really important that you know your status for hepatitis A and hepatitis B. If you have not have immunity, it's important that you get vaccinated for it. And just that you stay healthy, and that you know that you will have a support team that will help you along the way. So this is kind of like our program and some of the steps. One of the things that is really important to mention is that if somebody has hepatitis C and you go to the doctor, it's kind of like a process. And we're really trying to eliminate, the amount of steps. But right now, if you go to the doctor, for example, if you go to the doctor for checking your blood pressure, they will tell you have high blood pressure and you will get prescribed a medication. But for hepatitis C, there is some specific blood work that they have to do to check how your liver is doing. And then they will order the medication. And the medication has to be sent to a specialty pharmacy because that's the way it works. The medication for hepatitis C is very expensive. But what I'm trying to say is that there is a little bit of a process, but that's why our program is specialized on these, and we really will help you along the way. So the treatment for hepatitis C is really, really easy. 10 years ago, or a while back, it was like really different. It used to be you had to do a biopsy of the liver. You used to have treatment that was not very successful, and it was injection based. But right now, the treatment that we have is really accessible, and it's very easy to take. And the rates of cure are really, really high, like 98%. And again, it's all pill-based. It could be either that you take the treatment for 8 weeks or you take the treatment for 12 weeks. If it's 8 weeks, it's 3 pills per day for 8 weeks. And then we'll check you after you complete the treatment, or it could be for 12 weeks. And it's only 1 pill per day, and that's based on how your liver is doing and if you previously have been treated before for hepatitis C. Some of the side effects are really mild, like headaches, fatigue, nausea, insomnia, but nothing major as they used to have back in the day. These are some of our services. As I mentioned before, the REACH program is very patient-centered and takes a harm reduction approach. And we're really focused on providing primary care for people with substance use or a risk of relapsing. We have comprehensive treatment for hepatitis C. We also do a behavioral health evaluation and refer out for mental health. And we're kind of like detox rehab. We have a really good collaboration with other community-based organizations. This actually has changed. We have sessions on Tuesdays in the afternoon, Thursday mornings, and Friday afternoons. We don't have sessions on Wednesdays anymore. And we are a multidisciplinary team of staff members. We have physicians, nurse practitioner, psychologist, the director of our program, Dr. Weiss, mental health, social worker, outreach specialists, and patient navigators are bilingual. And these are some of the pictures of our providers and our team. And this is our number. If you need more information, if you want to get tested, please feel free to reach out. Our number is 646-951-1693. And you can also just email us at reach@mountsinai.org. Again, the testing for hepatitis C is completely free. And we're happy to just let you know about your status